can't be on?
I don't see him on the call. I don't know what's going on here, but between you and Brian, I think, and
Yeah.
then with the assistance of Peter and Bertie, I think we can make this thing happen.
Yeah, that's fine. I'll just let everybody know I have a dog that may need tending to occasionally. So if I go dark, that's what I'm doing.
Sounds
All
good.
right. Well,
Okay.
I'm Brian Estes, and I'm going to call our the meeting of the Behavioral Health Committee to order at 9:04. So we have a quorum, Jen.
Jill,
Well, Jill's not here today.
Jenna?
Jenna, excuse me, Jenna, yes.
We're, I think, one away from a quorum.
Okay, well, why don't we just get started, and then hopefully we'll have a quorum if we need to vote on anything. So first, the land acknowledgement statement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. All right, I think for those of you that joined late, I'm kind of helping facilitate the meeting. Dan Hamill is here and had an extremely late council meeting and that's not feeling great this morning. So between me and the new co-chair, Stephen Gockley, we're going to kind of tag team the agenda. And then first, we'll start with data needs for the committee, and I'll turn it over to Peter Frazier and Bertie Safford.
Okay.
Bertie, why don't you take this one? This is
Yes, because I'd be happy to.
Yep.
So I met with the co-chairs of the Behavioral Health Committee at their request, and they included Courtney Taylor, works for the defense attorneys at Whatcom Courthouse, and Nathan, whose last name, unfortunately, I don't have written down, but he also works there. And we had I think, a good discussion about what the purpose is of gathering data and why get our priorities out. And then we got down into the nitty-gritty about some of the things that would be helpful. So I guess I will use that Word document that I sent you, Jenna, if you don't mind displaying it. As most of you know, the Index Committee is reorganizing into two work groups, a policy work group and an IT work group. And so one of the goals of this is to prioritize our data requests so that when the two new positions that include a system analyst and another IT technical person are filled, we will be proactively ready with priorities from the IPRTF for the data that we need. So we started by talking about, I think, the role of data, and I like to frame it as for every project or new implementation plan or active program, what do we want to accomplish? And then what's the current status now, and how will we know that we're getting toward accomplishing it or that we're succeeding it? And to me, that's the most important role of data. So as we discussed, I think all of us that were at this small meeting agreed that it's very important to include race, ethnicity, and language data that's as recommended by GAIR on every program that we evaluate to look for any hidden biases or discrimination. And the other critical concept is we need to be able to track individuals over time so that we can measure outcomes of the work that we do. So with that, Courtney was a wealth of ideas and information about how she would suggest evaluating the programs that she's engaged in. And we, I think, agreed that so I'm using that as an example. And I think we agreed that the number of individuals who subsequently re-engage with the justice system would be the overarching desired outcome, because hopefully that would, in a perfect world, approach zero once we, provide the services that we're hoping to. And then she subsequently came up with a list of important shorter term measures that I have copied here. And you can see what some of the barriers are and how measuring these things would help track our progress. One is the length of time to reactivate their health insurance, because you all know that's a major issue. Adequate initial housing, getting stable housing. Are they engaging with their mental health services, attending appointments, are the meds available to them, and are they using them? Are they following up with court requirements based upon their status, and then the number of mental health emergency visits or hospitalizations? So this is an example of the kinds of data that we could request to help us with our programs and evidence-based measurement of them. Dan, am I leaving anything out of this? Dan may be elsewhere. So at any rate, I open this up for discussion and comment. I think my personal hope as chair of the index committee is that the behavioral health committee will endorse some recommended data so that, as I said, we're on the ground running when the county executive office is up and staffed to work on this. Comments, discussion? Arlene? I think you're muted.
That list looks very good to me, because what you're measuring is continuity of care. So it addresses the goals.
Good,
So thank you very much.
good. Other comments?
Bertie, I know that you and I have discussed a while ago all the work that had been done by all the committees pulling together items like this back 5 years ago, I believe it was, as part of the index committee. Have you looked at these and compared them to the work that had been done previously? Are you seeing a way that we can be helpful in getting to the most important data?
Well, I did look at those, not after this meeting, but
Okay.
I have looked at them before, and my sense of them, and I'm more than happy to go back and take a deeper dive, but when I looked, they appeared more a list of things that would be nice, like number of warrants, number of this, number of that, but not particularly organized around how will we know what we want to accomplish and are we accomplishing it? So it was, I'm sure that was probably in their background thinking. It just wasn't put on paper for someone like me who wasn't in the discussion to look at. So it
Sure.
was a little more difficult to wrap my head around. I'd love to have the committees that put those out, if they wanted to, just rediscuss it with that in mind, because I personally think when we're looking at data, it's very helpful to know what we're trying to accomplish with it. Yes, Brian.
I'm trying to enlarge my screen here. In general, are we constrained by HIPAA in having access to some of this data?
Well, the only time that HIPAA is involved is with medical and mental health information. And if, you know, all the court and all that housing, all that kind of thing is public information, particularly on somebody who's been incarcerated. So I think if we have a number, not a human name, that is allowing us to follow people over time, we can be HIPAA compliant. It's the personal information that we have to be extremely protective of. As you mentioned, that's exactly right.
So I'm having trouble expanding this document on my phone.
I can
but
actually
anyway.
see you adequately, so.
Oh, okay, but so I think can you zoom in on this, Jenna, a little bit and make it bigger? Yeah, okay. Yes, thank you. So under example, it says suggested measures for jail.
Yeah, that was my vague wording. I was trying to reflect
Yeah.
what Courtney does, and I don't really know exactly what she does. So what I was really meaning is measuring the mental health services and the reentry services. And it was only meant as an example because
Yeah.
I'm quite vague in the purpose.
Yeah, okay, that kind of makes sense. But going forward, are we going to get into the weeds a little bit more on exactly what kind of data related to what goes on in the jail?
I think that's up to the committee. I think it's what questions are most important for us to get answered. In the sense that I'm making an assumption because the people are not hired yet, but my assumption is even with the added folks, there'll be some limited bandwidth. And I see Melora has her hand raised. And if we want, Melora, were you going to contribute to this discussion or did you have a new point?
Yeah, I was hoping to just jump in and talk about this concept.
Yeah, Melora is obviously doing this as we speak through the health department. And so I will defer to her for your comments, Melora.
Well, I do have some feedback that I'd like to share, but Brian, to your point, you know, I think that data collection and analysis of that is, as we all know, a huge project. I'm 4 years in on trying to build a data system that can be analyzed for the programs that the Response Systems Division runs, and we are, you know, we're probably 50% of the way within our build, trying to build the interoperability that we need to be able to view the different data sets and be able to tell the story. So it's intensive, and it takes key partnerships and trust to be able to have the right data sets. And then you need the team to be able to do that analysis and program evaluation. So what I'm understanding, Bertie, is that the Behavioral Health Subcommittee and the Index Committee are going to give recommendations to the county on what you would like to see in terms of that broad scope of data collection and then eventually analysis. Am I correct in that?
Yes, exactly. I thought we needed a place to start, and that perhaps was more prioritized around our current needs than the original long list. And that's what's driving me to go to the different committees and discuss with them. And you can be sure that you and your representatives will be heavily involved
I-
to the
I-
degree that you want to in this.
I appreciate that. I do think that Health and Community Services has a really strong data team that has been doing this work specifically for the response system.
Exactly.
And we know that some of that learning and knowledge could be applied to this much larger project. But Brian, a lot of it is about what is public access already. The other, what can be requested through public records. So that's one of those areas. But when it comes to HIPAA, there are ways to de-identify the individuals, and there are ways to also get consent. And those would make different subsets that we would be able to look at. So if we have groups of individuals that are involved in reentry services that give us consent to, look at certain data sets, and we'd be able to have subsets. It wouldn't be the broad everyone that is engaged with the incarceration facility, but I think there are different strategies around that. What I would add to what I'm seeing on this list is just really grounding ourselves in the idea of the social determinants of health, right? It is really a whole, looking at individuals from a whole person model, education, employment, their working conditions, food insecurity, housing, which I see is on here, but income, early childhood. If we're able to, if our bar is to understand the types of individuals that are engaging with our justice system and our legal system, we're going to do a better job of providing services to them. So I think, yes, race, ethnicity, and language data, very important, but, income and other key demographics of the individuals that are involved in the legal system is going to be really important for us to know. So I think that initial set could be expanded. And then in terms of the short-term measures that you have listed out, and just, Bertie, Nathan and Courtney work for the Public Defender's Office as behavioral health specialists. So that's their role. And the attorneys, right, in different cases and representing individuals that have some behavioral health challenges. But my question would be, what is the length of time that we're looking at here? Are we looking at, are we following people and their engagement with court for 6 or 12 months after? Like, what is the time in which it's the clock starts, and when do we stop tracking that data?
Well, Laura, you're asking very important questions. First of all, I appreciate your comments on the social determinants of health. This was not intended to get down to that level of detail, because you're absolutely right. Before we really engaged in measuring any of this, we would want to be much more specific about exactly what we're asking. How do you define an adequate initial housing, et cetera, and how long we wanted to follow. It was more just to give a representative sample of the kinds of questions we could ask using data. So I don't see this going from here directly to the computer folks and saying, do this. I see us on the index committee or with anyone else's input, massaging and defining more how we want to measure the programs. Peter, you have comments.
When we were in Columbus recently, the 18 of us or whatever it was from Whatcom County, we got to spend an afternoon with a woman named Melissa, and her last name is escaping me. She's head of behavioral health services for justice involved folks in the county there. And when we were talking, it looked like their data project, I found this interesting, was a 3-year look before the individual went to their jail, and 3 years after. And I then asked her in a follow-up meeting, if that was a best practice that she knew, what, how far they had gotten on their data projects, et cetera. And she then sent me off to set up meetings with folks at the Council of State Governments, because they have a whole project devoted to looking at best practices around the very thing that we're going to be doing here. And so I just wanted to say that I'm taking a look there, and I will be reporting back to you on what I find, and hopefully it's going to be a good trove of information for us.
Thank you. That our policy work group has not yet been filled with members for the index committee. So if anyone is interested, I certainly welcome volunteers. And also I anticipate it starting in the next 6 to 8 weeks, probably, with the goal of looking at best practices, looking at these kinds of discussions, and being more ready for the staff when we actually have the opportunity to start measuring. Brian.
Yeah, just in general, I know following the discussion that this is fairly high level and will be fleshed out, but just one comment around mental health engagement or mental health services is how long is it taking for some of these things to occur once somebody enters the criminal justice system or the jail specifically. I would be interested in having some indices around those cases. Obviously, competency restoration, many other factors have an impact on timeliness, but I think that's one of the things that I'm concerned, and many others, as Perry well knows, are very concerned about this. So some data that talks about the timeliness of mental health interactions would be helpful.
Thank you. Perry.
Thanks, Verdi. One of the things that I wanted to relay to the group that I realize that we're talking about reentry services, so forth, into the future, to some extent. The current contract for jail behavioral health and reentry is oriented towards crisis response. I've talked about this a little bit before, but I think it's really important to keep it framed in the sense that if an individual is in a crisis, that is what actually triggers the process for the jail behavioral health staff, and obviously the correction staff and et cetera, to document, to respond, to measure the time frame, and et cetera. And so I just wanted to offer that particular piece. It's not that I'm thrilled about that, but when we start to talk about behavioral health, obviously, I think that everybody here is cognizant that we're talking, when I think about behavioral health in comparison to crisis, it's a very different dynamic. I'm glad we're addressing the priority from my perspective in terms of an individual's safety and security. But getting to behavioral health is a much larger challenge given the number of individuals that are incarcerated, et cetera. So I just wanted to offer that that information up for sort of framework.
Very good point. Stephen.
Yeah, I apologize. I've been in and out because I've got a sick dog. So I may have missed half of this. I've been trying to listen from afar. It makes sense to me that the suggested measures for jail and entry services come from a conversation with Courtney and Nathan. But we're envisioning a whole lot of diversion services, treatment services in the community. We're envisioning a behavioral care center of some sort, a 23-hour care center. And none of this addresses any of the sort of the treatment parameters that are going on instead of incarceration. So I don't know if I missed that that's part of your conversation. You just put this part on the sheet. I'm also interested in understanding the people we're hiring at the county are just going to crunch numbers that are given them. And right now, so those numbers would have to come from the treatment providers themselves. And I don't know what provisions you're envisioning for that. Right now, I know that at the Ann Deacon Center, we don't have any leverage over the treatment providers to provide data. Perry asks nicely, and if they're cooperative that morning, they give us something. So there's a flow of data from a whole bunch of actors that are primary in this that I don't think is being captured on this, and I just wonder if it's sort of on the work plan for the index committee down the road.
Stephen, those are really excellent points. And what I'm really hoping to do is start this conversation, because I think you're exactly right. The computer people and analysts are, I assume, going to do what we request or to the best that they can. And therefore, I'm hoping to get this very engaged conversation starting about what are our priorities, and of all the, enormous aspects of data, where do we start, and what's going to help us assess. And as Melora said, she's 4 years into what sounds like an 8-year project at least. So it's a major amount of work. And so I really appreciate this discussion. I'm going to go to Heather and welcome Heather. And then Melora, I see your hand up too.
Good morning, everybody. Thank you, Bertie, for this presentation and all this work. I also have been kind of in and out, as you know, so forgive me if I repeat anything, but I guess I'd love to just, the way I think about it is could this be a phase 1, phase 2, phase 3? And some of those shorter term measures, they look to me like a real program evaluation measure type discussion versus what's the public facing data that anyone might find meaningful or helpful. And even just starting with recidivism, how many people come back to our jail within 18 months or whatever the period is? Because that to me says we either did a good job with rehabilitation or not, and there's opportunities there. And the second one is, if I understood Perry correctly on the crisis orientation of the contract for reentry, I would love to have that conversation and have a culture shift of every single person should be engaged in a reentry oriented for rehabilitation versus just to prevent crisis. And from the moment of arrest, even that every single person in the workforce should be oriented towards how do we support and help this person get out and be successful, and how can this committee help with that culture shift if that's a need, or with that contract expansion. So I'm at that level of like, can we even just know what our recidivism rates are and how many people are coming back? And then the second measure that the implementation planning process discovered was how many people are currently or most recently homeless before entering the jail, how many people have a behavioral health concern, how many people have a substance use disorder, how many people have a co-occurring. Those, just having that like population level understanding of that snapshot was like 70% of the people in our jail actually have a behavioral health need. And are we meeting that need? And so I'd love to just start there, and not like, I wouldn't expect that would need a lot of the interoperability discussions. That could just be like, I don't know how that works, but that feels simpler, and then build into, okay, if we can get that for 3 months or 6 months, then let's move to phase 2 of these more complicated data inputs that then allow us to have more of that program evaluation discussion and support county leadership in contract expansion or whatever it is, you know.
Thank you. Laura, did you still want to comment?
Heather, I just want to echo what you're saying. I think recidivism, really understanding that is key. And I do, just to Stephen's point, and I think maybe it's a question of where the IPRTF plays a role in this. If we are asking multiple different agencies to eventually have a data sharing agreement with the county, we're going to really need to engage our IT and data experts on what type of platform is needed, the interoperability, the security of it, because it will need to be HIPAA and CGIS compliant. So, you know, there are, I think the earlier, and I'm sure the index committee is kind of looking at things like that, but the earlier the conversation is involving technology and what we're asking from our partners and what their concerns are, because I'll tell you, they will have concerns, and
Right? Lots of them.
right. And so really creating that list, to Stephen's point, but then also making sure that, you know, the right individuals are being given a heads up that this is eventually what we're wanting to ask from you as a community partner. And I think in all of the conversations I've had around data across the country, it's always about trust and relationship, right? And so we're not going to be able to have that large scope visibility if our partners aren't willing to share the data with us.
Right. I appreciate all the wisdom that's being shared here on this call. I will say that the other work group of the index committee is going to be labeled IT, and one of the charges to it is to begin the interoperability discussions. And so again, we are in the process of appointing people, and I think we've mined some, Heather, Peter, and I, some potential people, but I would welcome any recommendations, particularly from anyone here who's involved, about who would be the best people to have. I don't think we can clone you enough, Mallory, to put you in all the work groups that we need. So probably you hopefully will have some suggestions of people other than you. But anyway, this is exactly the kind of discussion we're hoping to have. So I very much appreciate it. Perry.
Thanks, Bertie. And again, folks may be aware of this, but kind of connecting back to what Heather was sharing, you know, and so forth, is that I think we're really fortunate that Caleb Erickson, you know, had been involved in the index committee, of course, you know, historically. And if I recall correctly, the booking process included some information, some basic information about individuals. And so, you know, again, to sort of tie back into what Heather was talking about, is that sort of overall information up front, we may be able to access some of that, you know, fairly quickly, or it may be, you know, what do I want to call it, maybe categorized, you know, at this point, to give us some general overall numbers, which from my perspective made a lot of sense. I mean, of course, some of it is self-report, you know, as they're doing the booking and et cetera, but some of it can be corroborated, you know, relative to obviously, you know, previous bookings and you know, and things of those nature. Of course, whenever we do data, you know, one of the first things that pops up for me as well, we've really changed the booking protocol and procedure in the jail relative to the charges that have occurred, which is going to skew, you know, that outcome. But you know, that can probably be, you know, smarter people than me can probably figure out, you know, how to compensate, you know, for that particular thing. But anyway, you were saying, you know, individuals that we might want to consider and so forth. I think that we also have a real advantage because I think Caleb really understands some of the data and some of the antiquated systems that the jail has used, and, you know, and can kind of speak to that as well. So forgive me for stating the obvious, but I wanted to, you know, make that reference.
I really appreciate that. And believe me, Caleb is high on our list. I think he's probably a very busy individual, but at the same time, he has worked extremely hard. We haven't been able to access the data that they have worked so hard on to this point. At the same time, he has done a lot. And my thought is, even if we can't compare historically, just getting a capture of the now in terms of all the data that they're collecting will help us go forward. Ying.
Hi, I apologize for being late. I had a patient added to my schedule at 9 who I needed to see. So I may be speaking out of turn because I missed the beginning, but I was just looking at these measures and wondering if there's a person with lived experience who is on the index committee who could advise on, relevant issues. One that pops to my mind when I look at this list is with all of these needs, there's no income for this person. So if they don't have a job or supplemental income, then how are they going to live?
Right. Well, I have invited Rosa Hunter, who is one of our new members on the IPRTF, who does represent lived experience, and she is interested. And so we're having a dialogue back and forth about how she could contribute. I'm open to other names as well. Rosa is a scientist by training, and I thought she'd be good because she also has familiarity with using data. At the same time, I'm not worried about having too many volunteers at this point. So if people have recommendations and suggestions for either of the work groups, I'm all ears. Other comments? I want to say that I really, go ahead.
I wonder if there's a way for the folks who run the facility to help us by finding a current customer for ongoing input. Wouldn't have to be the same person stably over time. Could just be a position for a current customer.
What do you mean, Ying? Do you mean a person who's currently incarcerated? Is that what you mean by customer, or am I misunderstanding?
No, that's what I mean.
Okay, good. Good idea. Well, I will turn this back to the chairs. I appreciate this very helpful discussion, and I look forward to more of them. So you know my name and send me all your additional ideas and recommendations. Thank you.
Well, thank you, Bertie. That was a very, very rich discussion, and one that I think the committee will be continuing to have as we move forward with this effort. I was just thinking of jumping to item number 4, because it might inform a little bit our discussion of agenda item 3 on issues for the committee to focus on. So with that, Stephen, are you okay with that?
Yes, I am, Brian. I had the same idea.
Okay, why don't we do that, Peter? Why don't you jump in, and then we'll address item number 3.
I don't have the agenda in front of me, I'm afraid. Item number 4 is which?
That's reconfiguring the task force committees.
Okay. Well, let's see. I want to invite Heather to see if there's anything that she would like to add to this agenda item. Heather, do you want me to just take it, or do you have anything you'd like to?
I actually don't have the agenda up in front of me, so maybe you could start and then I'll add in.
Sure. Yeah, absolutely.
Yeah, thank you.
Well, we had such a good meeting of this committee last time, discussing where we've been, ideas for better process and such. And so I think I really want to. I see the Behavioral Health Committee as a particularly well-functioning committee that does a lot of really good thinking, and I am delighted with all the work that it has done over time. Nothing I'm about to say is a criticism of this or any of the other committees. But we are very interested, Heather and I, in each committee reviewing its original charter to take some time to reflect in the next few months around its process, its configuration, its who is on the committee, what open seats there are, how do we move towards greater action, making, being the best advisory committee we can be to raise up the issues and make recommendations, particularly around all of the important work that has been done with the implementation plan. And the implementation plan offers us an opportunity to really, I think, focus around particularly important areas that are key to our putting together a system that is as well functioning and helpful to the end users, the people on the front lines of this, and the people who are cycling in and out of our jail, the justice involved folks. And so we are looking for opportunities for each of the committees to do that work over the next few months, so that we can make sure that we're really engaging and making a difference. It's been somewhere between 5 and 9 years that these committees, I believe, have been together, and now is a great time to do this work. And so many things have changed, including a whole public health crisis with fentanyl, a whole public health crisis with COVID, and all of the changes there. So I would really like to see if perhaps we could, as a committee, each committee, look at maybe 3 different items from the projects, from the implementation plan to focus on over a given year, and really see what we can do to make headway. I am presuming that some of those projects for this committee might be implementation plan project 15, to advocate for the state waiver and follow that through. A lot of work has been done. We're headed in the right direction as a state, but following that through is going to be critical for all the work that we're doing here in Whatcom County. So that is definitely something to focus on. Project 4, address workforce shortages in behavioral health services. I'm not going to read these in their entirety, but review your implementation plan. This is a critical one. We all know it all comes back to workforce, and how can we have a behavioral health workforce that can help us meet the moment. Project 9, to identify what additional facilities are needed to support people with behavioral health issues at risk of incarceration. This is something that we really need to be starting to work on and look towards. It is not for us, obviously, to do that work ourselves, but to support the staff members who are doing this, our elected officials. But we can be looking at good best practices. We can make recommendations and help by working with others to move that project forward. Project number 6, increase the capacity of effective existing programs to divert people from incarceration in tandem with community-based treatment and support services. And project 5, to build systems to facilitate communication and coordination between organizations, providing services for a seamless continuum of care. These are some of the, I think, projects that I would love to see this this committee really focus on, and to hopefully to make great headway on. I am not trying to prescribe anything here. I am looking for comments, for ideas on how best to focus so that we can make good headway. So I'll leave it at that for the moment and see what discussion comes from this.
Thank you, Peter. That's certainly a lot to consider. I have forwarded notes from, I believe, two meetings ago, where we listed potential policies to focus on, as well as some suggestions about process, or what I like to call how we do our work. These are very big ticket items. So I think we can, I guess I'm kind of two minds. Right now, we could focus on some of the process, how we as a committee do our business, or we could jump to the issues that we had. But I think, based on some of your thoughts, maybe we need an overlay between the implementation plan and our laundry list of items for policy, consideration. And Stephen, jump in here, but my thought is maybe on the policy considerations, we should defer that and kind of match it up with the implementation plan, and so we'd have a better basis of kind of doing some ranking and voting on which 3 or 4 items we wanted to focus on. Does that, and maybe we could talk about some of the process issues today as a committee. Does that make sense, Stephen or Dan?
I would like to hear other people's feedback on your question, Brian. I'd also like to suggest, Peter, that these are all big issues that don't, to me, seem particularly feasible to tackle in the whole committee month after month, and that the idea of maybe breaking down into some work groups within the committee might be useful and efficient. Also, there are a couple of them that already have a lot of work going on with them, though, tracking the waiver process. I know Kayla and Melora are all over that. And so maybe, I guess I'm not sure what the committee's role would be in that, other than staying abreast and informed and lending a hand when the leaders of those efforts determine that would be helpful. Would be appropriate.
Stephen, we're here and we're having a really hard time hearing you. Are you able to get closer to your microphone, perhaps?
I think it's more the microphone. Let me turn up the volume here. Is that any better?
That does sound better, yes.
Yes.
I'm sorry, where did I start mumbling?
I think we probably all heard you. It's just, I have to lean in.
Okay.
Okay.
I'll lean in instead.
Thank you.
Harry?
I think that's just Stephen's, approach to getting you to listen to him. That's, whisper loudly.
There's a strategy involved.
Jenna may have kind of an operational thing. Shall I stand by and have her check in, Stephen?
Yeah, I just wanted to jump in real quick and just remind everyone we don't have a quorum here today. So just in terms of decision making, just keep that in mind.
And I want to be very clear that I'm not looking for any sort of guidance or decisions at this moment. But this was something I wanted to throw out to the group for people to consider. And then, of course, it is really to the co-chairs to lead any sort of process around focus for the committee itself.
I actually am tagging on to something that Stephen just sort of ended his statement with, that as and actually Peter made reference to this as well, that possibly first, if it's broken up into, sort of members within the committee, gathering information on these particular implementation plans, there is a lot of work that's being done. And oftentimes I will run into, working in committees, not necessarily this one, but almost the assumption that, oh, we have this great idea, and it's like, actually that occurred a couple of years ago and we have the information. And so possibly the first step being, what is there, what has been accomplished, by other components, or entities, and then from there having that basis obviously and moving forward, and carrying it. So I offered that thought process.
Brian, go ahead.
I just wanted to add, I guess, feedback to item number 4 on workforce shortages. And I would suggest that that's really principally a federal and state issue to really make a dent, in having, more provider availability and the policy tools available simply at the local level. I think the committee's efforts might be better spent on other issues that have a more direct and immediate impact on our committee. And I know some of you who are following what the University of Washington is doing. They opened a new facility in the Northgate area, and it's a teaching hospital, and there's going to be a number of things that come out of that effort that will over time increase capacity. So I just wanted to share that issue. But getting back to where we go from here on today's meeting, there's a lot there's a lot to do here. I sense as we should defer our discussion of the policy issues and maybe in the time remaining. And Dan, you have to leave shortly. Did you have any other final comments or anything?
I don't, and I
Yeah.
apologize for the camera off. I'm feeling very under the weather. We went until 11 o'clock last night for city council, and I woke up with a cold.
Yeah.
I don't have anything else. I'm listening to the discussion. I do think that we need to follow up and have a more of a conversation on the direction of this committee in relation to the items that have been discussed here this morning. So I'm happy to keep that conversation rolling. And we're having a little bit of change in leadership. Sorry, my voice is kind of cracking up here. My new co-chair will be Stephen Gockley. And then Mike Parker is off to a private practice. And so congrats to him for doing that. But there is a change in leadership. So we have some reshuffling to do. And I'd like to be able to huddle with Stephen to discuss these matters a little bit and then confer with our co-chairs, Heather, Peter, and others to kind of just get a sense of how we want to move forward. And Brian, I agree with your assessment that some of these things are going to be well beyond the scope of this committee in terms of workforce, but I don't want to let that go quite yet. So I'd like to make sure that we still have some perspective on that, and I'll go ahead and just end there.
Yeah.
Thanks.
Well, having said that, Dan, I'm just wondering if item number 4 should be deferred to a future meeting, given some of the interim steps you just described with Stephen and Peter and Heather.
Yeah, I think that's appropriate.
I'll just chime in and say that I think I find agenda item 3 and 4 indistinguishable now. We started a discussion on how to become more action oriented, and there was a free flow of ideas, and then Peter and Heather and Bertie perhaps as well offered this structure for reorganization, refocusing, which as I said, I think that's almost indistinguishable from where we were headed with our earlier conversations. So I agree with Dan. I'd like to put my head together with his and benefit from the extra brain power he always gives us. And probably talk to the co-chairs and see if we can structure this a little more fruitfully in perhaps the next meeting. I also want to take the comments that we have lined up here from Heather and Melora.
So Stephen, would it be helpful just to very briefly just review the minutes of the meeting 2 months ago so everybody's on the same page? Because I think we have a differentiation between policy issues and process. And so I wonder if Jenna could just put that up there and we could we're not going to really discuss it, but just so people are aware of kind of where we were, signposting 2 months ago. So
I think that's a good element to add, Brian. I'd
yeah.
like Jenna to maybe circulate this to us so that we have this to
Okay. Yeah.
Heading to the next.
Yeah. Okay. All right. Well, then we should just move forward. And Peter, Dan's not here, but I would like to be involved, if I may, on some discussions about our process, because I do have some ideas for how maybe we could make that more robust. Okay. Well, I guess if it's okay with you, Stephen, item number.
Brian. Excuse me,
Yes.
Brian. I don't know if you can see the whole screen, but Arlene and me and Melora have our hands up, and we'd love to share some thoughts
I'm
before you
sorry.
move on.
I really apologize. Sorry,
That's okay.
I wasn't focusing on that. So why don't you go
Arlene was
ahead?
first. Arlene was first. Thank you.
Well, I waited so long, I forgot my first point. So anyways,
That's a
I think
strategy.
that the first issue for me is the planning of a crisis clinic. And yet we aren't going to be doing that work because the planners are doing it. But we still are very interested in it and want to make recommendations. So that's, I think, important. I think Brian said something that I disagreed with. I can't remember what it is. And oh yeah, he said that we couldn't influence the staffing, but we can. We can come up with ideas to influence it. You would be surprised at the very bright ideas that some people have. It's a matter of pushing it forward and recommending it. It's very crucial, the staffing. I speak this from a treatment point of view. My first job was for crisis respite, and I saw that the staff was the least experienced working for the most complex kind of treatment issues, and that concerned me. I was the exception to that rule, but it was just my circumstances at the time. And so I think the implementation of the crisis clinic is absolutely vital for us. I don't need to tell you that, but I want to re-emphasize it because from the beginning, I thought that if we can catch the people with problems early and make it easy for them to get treatment, and that we were going to solve a lot of problems, our social problems. So,
Well, thank you. Thank you, Arlene, for that comment. And I don't really disagree that there isn't some things we can do locally, but my only thought was that to really make substantial change in the number of providers, it's really things that the state and the federal government can play a much larger role in helping.
you're right, but you shouldn't give up.
Yeah. Okay. No.
The reason that we have this
Yeah.
clinic is because a lot of people didn't give up.
Yeah.
And many years. So
yeah.
Folks,
No, I really think we're on the same page with this.
Just for the flow of the meeting, I'm going to say we've got some differences of opinion here, which is fine. And the point is on the table and we've agreed to carry on this discussion. So I think we're in a good place that we're going to talk about workforce issues down the road.
So we had Heather and Melora that wanted to had some comments.
Melora, do you want to go? Melora, do you want to go before me? And
you, Heather, I would love to, mostly because I also need to jump off for a 10 o'clock meeting. Okay. I can't stay for the rest of the time, but I do just want to share to, Peter's list and these very large items. I would love to engage in the conversation of what meaningful recommendations from an advisory committee would look like as someone that is in a position trying to guide this work and fund this work and write the contracts and hold the providers accountable and all of those pieces. And so I do have some pretty strong opinions on what I think would be a powerful way that an advisory committee could give clear, strong recommendations to policymakers that they don't have to spend a lot of time with to be guided in decision making. So it's obviously a much larger conversation, but I would love to share my thoughts on it. And I think there are other people in government that could maybe also give their opinion on, right, when you are trying to decide what to do with a pot of money and make meaningful decisions, how does a body like this stand out in making clear recommendations? So I'll just leave it at that, and I apologize that I have to leave, but I do appreciate the robust conversation today and hope to be able to attend these meetings moving forward.
Thank you so much, Melora. And that is a great direction for us to go. We'd really like to hear from you.
Melora, I really appreciate that. I have a fair amount of experience with crafting recommendations that are actionable, and I would love to have a side conversation with you on that topic.
Great. Thanks, everyone. Bye.
Heather, go ahead.
Yeah, thank you, Stephen. I actually also would love to, I'm glad the original scope of the behavioral health subcommittee was included in the packet. And the provocative thing I want to say is looking at those goals from nearly 10 years ago, we're still working on a lot of those goals. We haven't, like if we had the dashboard there, some of those are red, they're not even yellow. And we have a couple greens too. And so I'm wondering about our agenda structure shifting so that we focus on, and I would love that conversation. Maybe that's the next committee meeting is Melora and us talking about how do we give meaningful recommendations? What is our role when the county staff is really implementing work? What's the purpose of us? Because we don't want to waste county staff time either. but looking at the original goals, why have we achieved them or not? Are they still relevant? Have they changed? That could be a section. And then we could take one at a time for the next 6 months. And then there could be a section on the agenda that's J-pop goals. And what's the update that's useful for the committee, or what's the action that the committee needs to take? But we're not necessarily going to be the implementers or builders of things. So, but we want to keep the work in our, awareness, because that helps us be productive members as well. And then having a policy section on the agenda, and just having structuring the agenda to support advancing each of these goals and keeping them front and center. And maybe those sub goals get switched out over each month, but that our agenda is supporting the right conversations. That's my suggestion in a lot of words. I'm sorry. I'm also tired. 11 p.m., 3 a.m., 5 a.m., 7 a.m. So thanks for your grace with me in
I
this
think we're just
moment.
thankful you've shown up to this meeting, Heather.
Thanks,
So
Peter.
thank you.
Yeah.
That's very helpful input. Thank you, Heather. So I think, Brian, should we move on?
I think Heather just provided a great segue into item number 5, agenda items for our next joint meeting with Law and Justice. So I think restructuring the meeting, perhaps along the lines that Heather's suggestion, is something that will be discussed between now and our next meeting. But I think the agenda item was, what items would we like to discuss with Law and Justice?
Anybody have thoughts?
The juvenile, I'm not using the right terminology, Stephanie Kraft, juvenile services within probation and the court, is in the process right now of receiving some substance abuse block grant dollars to do some specific work just around juveniles that are in custody and I think involved in the court. So that might be, again, it's very new, it's very early, but it's being framed up. And so Stephanie might be willing to share that behavioral health judicial involvement information with us, just to update folks.
I will add, it looks like the agenda for the joint meeting includes a presentation from you, Brian,
Yeah,
on,
that'll be short. Yes, like 10 minutes. Yeah.
yes, on framing adversity, trauma, and resilience. And then there may also, I think there's a presentation on the Skagit Community Core Program. And that's currently what we've got.
And getting back to Stephen's point about work underway, say on the state Medicaid waiver, I'm wondering, Stephen, if it might make sense to get kind of a status update, perhaps, on that issue. And I'm just thinking reentry continues to be a very large issue. Maybe that's too big to put on the agenda, or maybe there's portions of reentry issue we could put on the agenda. Do you have any thoughts on that, Stephen?
I can touch base with Kayla. My understanding is that most of the attention in that, I'll call it advocacy effort, is around Medicaid reimbursement rates. And I know Kayla and Jan Rose Ottaway Martin are putting their heads together on that. And that to me seems like the concrete workforce enhancement issue as well, that we might have some local or state influence over. I don't know whether they're getting into buckets of services like reentry or not. Certainly that could fall within the scope of the transformation waiver, Let me check with her and see, whether an update on that work or progress to date on that work would be useful or ready.
One other item that I would like us to consider, especially as we move forward in the calendar year, and it kind of goes along with Heather's suggestions for, you know, having kind of buckets of high-level topics we talk about, is what is Whatcom County's legislative agenda for 2025 related to behavioral health. I don't think it's actually too early to at least start giving some thought to putting down on paper some of these things and have a better, more well-coordinated kind of robust discussion with the executive side on this as well. And at some point in the fall, there are contract lobbyists. So I just think it's very important that Whatcom County's in a better position, I think, when some of this is kind of bottom up. So I'll just leave that at that. So I think we've got do we have enough for a tentative agenda at this point, Stephen, for next month?
Well, I think that's a great start. I would also say, just stepping up a level, our co-chairs have done an admirable job trying to exhort us to refocus, reorganize, and rethink what our work is. And I think that's a level of conversation that we could have in the joint committee as well, because I don't think we're as clear as we were 2 years ago when we started those joint meetings, what exactly the areas of productive overlap are that we should be meeting together on. So I think having a discussion like that would be a useful piece of the agenda as well.
Yes. All right, before we move to just go to the order with the time remaining, are there any other comments on an agenda for next month? Okay, has anybody else got their hand up here? Let's see.
No, we're good.
Okay. Well, do we have any, with the time remaining, do we have any good of the order comments?
Jenna, public comments?
Yeah, we do have one person in attendance today. If you would like to speak to the Behavioral Health Committee, go ahead and raise your hand now.
And then she's all over somewhere else, and I'm like,
All right, there's no hand raised.
Okay, then having run through the agenda, we are adjourned. Thank you, everyone.